Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so excited to introduce my guest today, Dr. Ryan Steele. He is the newest pediatrician at Leawood Pediatrics. Dr. Steele brings a passion for high-quality, comprehensive pediatric care and a deep commitment to supporting families at every stage of childhood, from newborns to teens. He earned his MD and his Master's of Public Health from the University of Arkansas and completed his residency at Arkansas Children's Hospital, where he also served as the chief resident. While he has a special interest in sports medicine, he truly enjoys all aspects of pediatrics and believes that the best care happens when families and providers work together as a team. As a new parent himself, he brings both clinical expertise and real-life parenting perspective to his work. He currently cares for newborns at Overland Park Regional and Advent Health Shawnee Mission and is accepting new patients of all ages. So if you need a great pediatrician, Dr. Steele would be one of them. I'm so excited to have him here today to talk about teenage boys and puberty. With that, let's welcome Dr. Steele.
Yeah, thank you for having me. I'm excited.
Yes. Okay, so we're going to be talking about such an important topic, boys and puberty.
Yes.
Yes. I mean, it's an important life stage.
It is. It's an awkward time, but something that's important to talk about early and often, even though it is sometimes uncomfortable to talk about, especially between teenage boys and parents, but it's vital.
Yes. Okay, so tell me, when we say puberty, what does that even mean? Like when we're thinking about that in general?
Yeah. So puberty is really just kind of, it's referring to a time of life when there is an increase in certain hormones, which then there's a lot of different things that kind of come as a result of that increase of hormones, and including growth, both in height and weight, differences in sexual characteristics in terms of like growth and everything there, and just a really big time of change in the body in terms of physiology and what's going on in terms of what the hormones that control our body, how they're changing.
Okay. When does this normally start in boys?
That is a great question. It's a little bit of a range. And the average age of puberty onset is 11 and a half. But that's a textbook answer. Most of the time you won't see any changes in the body until a little bit after puberty starts. And so, but the general range is anytime between 10 and 14, honestly. It's a wide range and each boy is different.
Sure. So how do we start this conversation? So we're like thinking like, okay, I have a kid who is maybe in puberty and I didn't realize, like they're maybe 10, 11, 12, or like they're starting puberty and I haven't really talked to them about anything, or they're younger. I don't know. Like, I don't know what the right age is to start this conversation, but then also like how do we engage it? Like, how do we start this conversation to let boys know that things are going to be changing about their bodies?
Yeah, that's a great question. And it's going to be a little bit different for each family in just terms of like how your relationship is with your son. I am a big proponent of well before puberty starts, parents setting aside time to just spend time with their boys. And we're talking about like elementary school, well before puberty, having a periodic time when you go and do an activity with your son that's just you and them. It can be dad and son, mom and son, whomever. And that can be a time that creates a comfortable environment for a conversation. I think that a lot of the times whenever boys are put not on the defensive, that's not like the right term maybe to use, but just kind of taken aback is when suddenly we're doing something that's not normal in our lives. And also you want to talk about something that's awkward. And so if we have this kind of routine of like, I don't know, you go go-karting or golfing or whatever you and your family want to do, and you have that time that's kind of, you can discuss things about how it's going on in their lives, it won't be as abrupt. Does that make sense?
Totally.
Like it's less of an abrupt conversation. It's still going to be kind of awkward, but I think that if we as parents are able to kind of introduce the topic of, hey, there's this thing that happens in everybody's life. There's a lot of changes. It's a very confusing time. It can be a stressful time, but it's something that you're gonna maybe have questions about. And I want you to be able to feel comfortable talking to me or whomever about it. And kind of just opening up the conversation there. I think even before puberty starts, and kind of preparing them of just, some things that are going to be changing with their body, and some things are going to be changing with their emotions, and you're going to maybe feel differently on a daily basis. You're going to feel stress differently. And so I think that I think it needs to be a dedicated conversation. I don't think this is like something that, we're hanging out while we're doing other stuff. I think it's important to have this be a dedicated time to where your son or whomever, the boy is, that they feel comfortable being uncomfortable, I guess is probably the way that I would put it.
Which is hard. And each kid is different. I know that we got the whole like puberty, how our baby's made conversation with my oldest son, who's now 13, when I was pregnant with my second child. And so when he was like, okay, I want to know all about this. And so then this like opened this conversation, right? And not every kid is that curious, or maybe we answer it very like generally, right? Like, and we don't give a lot of information, but I think that kids want information. And what I've learned in my practice is you have two choices. Somebody's going to educate your kids. It's either going to be you or someone else. And normally the someone else is their friends. And they may not have been educated by parents either.
Right. Yeah, I completely agree. And kind of fostering that inquisitiveness, or like, especially if there's a big life change, like if you were pregnant with another child, that's a great transition time. It's a great opportunity to kind of introduce this concept. They're going to be curious. They're going to have questions. They know that this didn't just happen. And so I think that that's a great opportunity to do that. If there's not a natural segue into kind of introducing things like puberty, things like sex, things like that, then it is a little bit, it does take kind of wading into those waters. Hey, we're going to have some conversations. I can tell you, my dad, he introduced it with, hey, we're going to be having these periodic conversations, and just kind of know that, expect that. If you've got questions, that's the time we can talk about it. But I do think that, like you said, I completely agree. Somebody's going to be teaching them about this. And what I think every parent would agree on is that they probably would rather that person or thing not be a friend, the internet, anything like that. They would rather it come from them.
Yes. Yeah. And I think because kids do want it from us, I think it's just that it can be uncomfortable for parents to talk about, and you can acknowledge that. I think, that's also totally okay to say like, hey, my parents didn't do this super well. So I don't really know what I'm doing here, but I know that this is an important conversation for us to be having. And so give me some grace, or like understanding that like, I might say something that feels uncomfortable, or, like I might not say it right, or I might not explain it well enough. Ask questions. I want to make sure I'm giving you the information that you need and that you want, and to help you stay healthy and successful.
Yeah. And really just normalizing it and making them feel comfortable in that space to express, like, yes, this is awkward. It's, every one of your friends is having some version of this go on as well. And so really kind of trying to normalize it so that they don't feel puberty can be a very isolating time. And a lot of kids can kind of feel like, I'm going through this alone. Exactly like you said, making sure that you feel they feel that connection with you, and that they feel comfortable kind of not feeling so isolated and alone.
Yeah. Well, and something else that might be helpful, like with like having conversations, is also like identifying other trusted adults that you have in your world that you would feel comfortable as a parent having your kid talk to. So if there's like an aunt or an uncle, or, grandparent or maybe even your pediatrician to say like, hey, like we want to start this conversation. Like they're also a great person to talk to if you have questions about different things that are happening. Your therapist would be a good person if we have that, or, like your cousin who's older and mature, right? Like these are people you could talk to ask questions about that would be a good alternative to just the parent. But like you kind of identify that, then it's not just one person.
Absolutely. And I do see that a lot in sometimes I would say the most frequent example is maybe single parent households, especially those with like single moms with sons. Sometimes this isn't a conversation that you necessarily want to have with your mom. And I think that just kind of exactly like you said, recognizing that and helping them to identify a trusted adult that they do feel comfortable with. And as a pediatrician, that's part of my job is to help kind of guide that side of things. And so that's another thing is I think that maybe if there's a level of guilt that maybe if you're not the person that your child is going to want to have those conversations with, but they have somebody else identified, that's okay. That's okay. I mean, that is, you have done your job in terms of helping them to feel most comfortable to learn about what's going on in their bodies.
Yes. Okay. So before we get too much into the boys part, is girl puberty a little different age range than boys?
It is. So generally speaking, girls do enter puberty earlier than boys at an earlier age. It's closer to that 10 11-ish age range. Boys are a little bit later than that. There's a whole pathophysiologic answer as to why that is, but it is, girls will start to develop kind of pubertal characteristics on average about a year or two before boys do.
Okay. So talk to me about like what is considered late or early puberty, because sometimes excuse me, there are boys that seem to be going into puberty way sooner or that seem to be way later, and like also why are we concerned about that?
Yeah, that's a great question. So the puberty is considered to be early if boys are experiencing kind of pubertal characteristics, meaning, I mean, I'll get a little scientific here. I am a doctor, but if like a testicular enlargement is occurring before age 9, that is considered early, and that is something that would need to be addressed medically because typically in boys, that is something that we need to ensure that there's not a bad reason why a boy is entering puberty early. So before age 9, that's when we would consider that to be a medical concern. And then puberty is considered to be delayed after the age of 14. But remember I said that, boys enter puberty before we actually physically see that on their bodies. And so typically it's, if we aren't seeing like characteristics of puberty at age like 15, that's when we start to say, okay, well, let's just make sure that, there's nothing else going on. There's not a reason for there being a delay. But that like 6-year gap, I mean, you're going to see different boys entering puberty at any point during that gap. And so that's one of the hardest things, I think, because especially during that time period, you think about age, 10 to 14, that's middle school, that's early high school. You've got some boys that are, entering puberty very early, and they're friends with boys who are entering puberty a little bit later. And that's just weird and different when you're in a time of life where you're also comparing yourself to your peers frequently.
Sure. Yeah.
And so that can be scary, but also just kind of, and that's where, again, that's part of my job is just letting boys know, like, hey, this is normal. Anything between 9 and 14, it's very normal.
Okay, so let's talk about what the puberty things we're looking for in boys are. Like, what are the different changes that happen during puberty that are like the signs? Because like we know like body odor, that's one of the things, like, right? Like that one's coming up. But there's other things that maybe we're not seeing externally or that are like a later sign of puberty where it's like first it's more like these things and then it moves to something like facial hair, right? Like that's normally not something that we get right away. So what are the things that parents are seeing that are signs of puberty?
Yeah, so the earliest signs are going to be probably something that parents of 9 and 10-year-olds maybe aren't looking at super frequently, and that's testicular enlargement and the development of pubic hair. But something that they may see, especially like in the summer times when they're at the pool, is things like hair in the underarms, maybe even a little bit of a hair on the upper lip, that sort of thing. Voices start to change. They kind of drop in octaves sometimes. In terms of like how deep their voice is getting. Growth spurts are typically, I mean, honestly, I can't tell you the number of times moms have come to me and said, well, I think we must have hit puberty because my grocery bill is about twice as what it used to be because they're just eating me out of house and home. And that's not uncommon. So growth spurts, that sort of thing. But the earliest signs I would say are definitely kind of body hair development, and with that comes the hygiene issues, the smell, things like acne and that sort of stuff.
Yeah. Okay. So talk to me about growth spurts. You just said why, when do they happen, and why are we having why isn't it just like a slow process? Why does it happen so fast, rapidly at times?
Yeah. So that comes down to how your body is changing. And in boys, the biggest change that is happening is the increase in testosterone, which I feel like it probably most people kind of grasp to some level. But I think that what is important to kind of understand is that most everything that boys experience throughout puberty is a secondary effect of that increase in testosterone. So bones have receptors on them that respond to increases in testosterone and increases in growth hormone, which increases because of testosterone. So when there's more testosterone, there's going to be more bone growth. And so because of that kind of rapid increase in the hormone level, those bones are going to respond accordingly. The growth plates physically get bigger. And so that allows for those bones to kind of rapidly elongate, especially what we call long bones, so legs, femurs, tibia, and that sort of thing. So that's where we really see that growth spurt, typically with height, and it can be a lot. I mean, it can be inches per year. But that is typically what we're talking about whenever we talk about a growth spurt. As to when that happens in puberty, tough to say. It obviously depends on when your body begins puberty in the first place, but generally a couple years into the whole puberty process is when the body reaches testosterone levels that are high enough to kind of accelerate that bone growth.
Got it. So, okay. So I just had a thought. So I know that when I bring my daughters or my son to the doctor or the pediatrician, they do they check in their vaginal area or their penis area, right? So you're looking for growth in testicles then. Is that what you're looking for when you're doing checks? Or, I mean...
Yes. Yeah. So that's always I always say it's the awkward part of the doctor visit, but it's always for, it's for health reasons. It's so that we can make sure that kids are progressing through puberty as we would expect them to. So yes, I'm looking at testicular size. I'm looking at the development of pubic hair, which there are different stages. There's literally a staging system for staging progression through puberty. It's called Tanner staging, and that looks at a couple of sexual characteristics, but particularly in the private area. And so that is why we do check, and it's not fun for anybody, but it is for their health. And so, but yes, that's mostly what we're looking for is size change, and then as well as the development of pubic hair.
Yes. Okay. That makes sense. I think sometimes it's we're just checking to make sure everything's good, but then it's okay, but what are we looking to make sure that everything's good? What are we exactly checking? And I know that I learned that in endocrinology, they have beads that are the size of different testicles to stage where you are in puberty. And I was like, oh my gosh, this is genius. Cause then you have a direct correlation to be okay, this is how big, right? Yep. And we expect you to be at this, or we expect you to be here still. And so it gives that visual thing. And I was yes, smart.
Yeah, that's exactly right. I personally don't use the beads frequently, but that is something that the pediatric endocrinologists use, I would guess, on a daily basis, because they are wanting to be as precise as possible. We have very specific measurements when it comes to size change that allow us to know is this normal or is this not normal? And so, yes, we have a tool to kind of help us out.
Yes. Yeah. Okay. So let's get to voice changes. And that's, as you said, like changing the octave of your voice is part of puberty. So something that I know can be really awkward is the voice cracking for boys.
Yes.
Like, okay, is there anything they can do to prevent that? And also, like, why is that happening exactly?
Yeah, it's a good question. It's super common. I feel like almost every boy goes through that at some point. In terms of like preventing it, I'm not sure unless you're constantly focused on not cracking your voice, and even then, I don't know that would work. There's not a big prevention of it. All of it has to do similarly to like what we were talking about with growth spurts. It's the growth of the larynx, which is a piece of the airway in the throat. Which is where the vocal cords or the vocal folds are contained. And the larynx physically is growing at a rapid rate. And when that happens, the vocal cords or the vocal folds are growing to be longer, as well as just kind of bigger in size. You can think of it, it's a lot like the difference between like a violin and a cello. You know, a violin is smaller, the strings are smaller, they're shorter, and it plays typically higher notes. The cello is a larger instrument. The strings are longer and thicker, and so that it generally has some lower notes. You can think of your body going from a violin to a cello, but that's not a perfect process. It doesn't just flip a switch overnight. It's going to be a slow transition. So you can think of the voice cracking. What it is because some of those vocal cords just haven't quite elongated and thickened yet. So it's like you've got a violin string on a cello. And so at that point, that's when every once in a while you'll get that, you're speaking low, then all of a sudden, you kind of jump up a little bit. So unfortunately, I'm not sure that I can't suddenly make your violin string a cello. And so unfortunately, it's just kind of part of it and something that you just kind of work through puberty.
Yeah. Well, and I think it's like, sometimes we just have to laugh, right? And be resilient through it of just like, this is, just be like, well, this is just what it is. Like there's nothing I can do about it.
And I think that's one of the hardest things throughout kind of adolescent and pre-adolescent and adolescent years is I remember growing up and just feeling like everybody was always paying attention to what I was doing. And so I was constantly worried that I was being embarrassing or something. And at the end of the day, I think maturing and growing up is realizing that most people don't care. They're not paying attention to you, but it doesn't feel like that at the time. I'm always impressed in my practice, the boys who are able to just kind of laugh at themselves and go, I was, in class and I answered a question the other day and my voice just cracked through the roof. And that's just how it goes. I'm always so impressed with that because I don't think I would have had that mentality when I was their age.
Yes. Well, and I think we're all going through it, but like, we're not like actively talking about it too. Like, I think especially the boys don't seem to be like having conversations like about it necessarily. It's just like that funny, weird thing, or like, they're like, a friend being like, did you put on deodorant today? Right. Or like that kind of thing versus it being an actual conversation. So it can feel awkward, but really it's something that we should talk about because everybody's going through it, even if like they're, late to start or they started or like everybody's been there, including your parents. And so like knowing that like this is just a normal part of development and we'll get to where we're going. And then those things like, the growth pains in like your leg when you're growing really fast and it like hurts, like that gets like it ends, right? Like, and then our voice will get to whatever it settles and then that part will end. And unfortunately, the deodorant part doesn't end, but speaking of that, let's talk about hygiene. Okay, so hygiene or lack thereof, I think could be a frustration for lots of parents where they're trying to like coach their kids like to these things like washing your face and taking a shower and, like not just getting in the shower, but actually washing your hair while you're in the shower and wearing, deodorant and whatever. Changing your clothes, not wearing clothes you've already worn, like whatever it is. How do we have these conversations with our kids without making them feel like ashamed because acne happens even if you do wash your face, right?
Yep, absolutely. It sure does. No, this is such a hard question to answer because it really is. I mean, you're touching on a subject that can be embarrassing if people are bringing it to your attention in a negative way. I think that part of it is, again, kind of going back to those pre-pubertal years and really building in that routine of, yes, we're going to take a shower every day. Yes, we're going to brush our teeth every day. Yes, we're going to, like you said, the deodorant thing kind of comes with puberty. So that's a new thing. But like, saying, hey, look, parents are putting on deodorant every day. So this is just part of growing up. And this is just kind of something that you have to do. I think that, it really, I don't know that I have the perfect answer in terms of what to do, but I think I know a little bit of what not to do. And that's really not make it like a shameful conversation, like really trying to not be like, you stink, this is bad, your hygiene is bad. That's not, nobody is going to be receptive to that, teenager or adult. And so really trying to be like, hey, bud, this is not your fault. This is just something that your body is going through. But unfortunately, it is something that we have to address. And here's how we address it. And it's just going to make things easier for everybody if you're able to keep up with that. But a lot of that is building habits. And some of it can be kind of weird because some of it, I mean, you know your son or daughter or whatever better than most people do, and so knowing that if you have to stay on top of them to make sure they're wearing different clothes or wearing different underwear or did they shower today, it may take some reminding. But I think as long as, I mean, it goes back to what we were talking about, normalizing the conversation and letting them know, like, I'm not telling you this because you're in trouble. I'm telling you this just because this is a new part of your life that we have to kind of incorporate into our daily routine. And then once they're doing it, being like, hey, I think also that's the other thing that we lose is the kind of the positive reinforcement side of it. Hey, I even though it seems like a normal thing to maybe adults of like, yes, you shower every day. Yes, you put on deodorant. That's maybe new for your son. And so kind of being like, hey, I noticed that you put on deodorant today. Thank you for doing that. Did a great job. Like that's really, I mean, I think that boys respond to everybody responds to positive reinforcement to a greater degree than I think we even realize in the moment.
Yeah. I saw a family friend who has a teenage son, and I was going to say something to him, and I walked into his room and I was like, oh my gosh, this smells delicious. Like your room smells so great. Right. And he was like, what? And I was like, I just, sometimes when you walk into a teenage boy's room, it smells, like, I don't know, like working out and going to soccer practice and stuff. And I was like, your room smells great. But I think he liked that, affirmation that he was doing that well. And so, and I think it's also like, I know that there are parents who have been like, okay, we started on this deodorant. That's not really working. And so to be like, hey, like, how do you feel like that deodorant's working for you? Like, the goal is that you don't smell yourself. Do you ever smell yourself during the day? If you do, let's try something else. Right. So I think it's also like setting those expectations of like how to know and to ask, like, if you want to try something else, just tell me. Like, there's plenty of scents and there's plenty of brands and there's plenty of shampoos and whatever. Like, you can try it all, but like, you just have to let me know. And I think that helps with conversation, right? To know that like, you don't have to start with this one and then that's what you use forever.
Absolutely. And like, really, I mean, they're at a time in their life when being told to do something is maybe not the best way to approach it. It's their body. They are learning how to manage their body and everything. And so exactly asking those questions, hey, how's this working for you? Is this going okay? Asking them about, same thing kind of goes for acne as well. Acne care and acne management. Hey, is your acne bothering you? Are you feeling self-conscious about it? If so, let's work on it. Let's try to figure out a way that we can take care of it. I always kind of tell people that things like acne is as much a problem for me as their pediatrician as it is for them. If it is bothering them and they are not happy with the level of control that they have over their acne, okay, then that's my problem too. We're going to figure this out together. If they're like, well, yeah, I get, some acne every once in a while and it's not really a big deal. Great. Okay. We don't have to go crazy with it. So I think that really asking them, how do you feel? And then that's when you get into, well, are you smelling yourself? No, I don't smell myself. Well, bud, some of us are. And so maybe let's change things a little bit. And that's okay. Maybe you just didn't notice. Yeah.
Yeah,
so
totally.
I think that kind of asking and not assuming is a huge part of that.
Yeah. And giving them some control, I think, is also an important piece because, they might be going this direction and they like their hair like this and now they want to do it a different way. Like this is a total stage of experimentation and figuring out what you like and don't like. And maybe, if you're wanting the girls to notice how you're smelling, you're going to be like, okay, Mom, how does this smell? Or asking your little sister, do you like this smell on me? Right. Like, and they're going to be trying these things out and to give them like good feedback on that. Like, oh yeah, I do like it. Or this one isn't my favorite. Or like the one you wore yesterday better. Or like, what do the girls seem to like? Or what do you like? Right. Like whatever their goal is for that, to support them in that piece, because we are getting interested in relationships too at that time.
Absolutely. And the kind of last thing, I mean, bring them to the store. I mean, I guarantee you most teenage boys have not really like taken a solid look at the deodorant aisle, but there's hey, go pick out whichever one you think you want and we'll try that one for a little bit. And if that's not working, cool, we'll come on back. But kind of getting them involved in everything. Like you said, they've got some buy-in. There is a goal. They are wanting to impress their peers. If they're interested in, talking to people in a romantic way, then okay, they're going to care. And so don't think that, I think that I would caution parents to just assume that they don't care about what they look like or smell like or anything like that, because I think they probably do.
Yeah. Most of the time. I think it's, sometimes they're oblivious, but it's not very often I actually find. I mean, there's a few, but it's like, they thought, oh, this is normal. And then it's like, oh, actually, well, I think it could be better. Like it could be, managed better. And then they're like, oh, this is better. Right. Like they appreciate that help too. But I think it's all in the verbiage, how we're saying it for sure. Okay. Absolutely. So let's talk about nutrition. Are there things that during puberty, like are supporting this positive process of going through puberty, or things that don't? Like, how should we be supporting our kids in terms of diet?
Yeah, that's a great question as well. Diet, it plays a big role in growth and overall health. I always kind of say that, there's one medicine that you put into your body every day of your life, regardless of what sort of medical problems you have, and it's what you eat. And so really, I mean, there's not going to be a whole lot of outlandish. I'm not going to rewrite the textbook on diet and nutrition here, but it's going to be the kind of the healthy foods and the wide variety of things that are going to be most beneficial with what I think a lot of boys and their parents' goals of puberty are, which is growth. They everybody wants to optimize your growth and allow you to be as big and tall and strong as you are able to be. Things that can be helpful. Any sort of vitamin intake, any sort of just general balanced nutrition. Things that are not going to be helpful are your classic, mac and cheese and chicken nugget diets, where it's just there's not a whole lot of nutritional value there. It's particularly oily foods, fried foods can exacerbate things like acne, can make you just feel worse. Your body's changing and can change in ways that you may not want it. You can, kind of gain some of that fat tissue that you were maybe not hoping to put on. And so, like I said, I don't know that there's any sort of like novel component to it, but this is a tough conversation because teenagers want what they want, and what tastes good is fried foods and fast food and that sort of thing. And so that's where, again, I think a lot of it comes back to just open communication and having those conversations and allowing them to maybe have some choice. Hey, here's some options that we have for dinner tonight. What would you like? Would you like chicken or pork or whatever the case may be? But what we're not doing is we're not ordering Domino's, or we're not going to McDonald's. And so kind of giving them that buy-in and that choice, so that the habits they develop during these kind of pivotal years are going to carry on with them into their 20s and 30s and beyond. And if we can kind of build that palate and that kind of nutritional value now, it pays off multitudes down the line.
Yeah. Well, and maybe it's also like you said earlier, you're talking about like having a time that you spend just with your son or daughter, but we were talking about son. So like where you go out and you do something, it might be like we eat out on Fridays, or like we like do take out after your whatever game or whatever it is, like to try to like minimize it, where it's not something you don't ever have, because I don't think the goal is never have something that, everybody else seems to be having, but it's more about management, right? Everything in balance.
Yeah. And that's a great point, because I'm certainly not a teetotaler. I'd be lying if I said that I hadn't eaten like carry out pizza earlier this week. But and to your point, like making it much more the habit of generally having healthier foods and going and having fun and eating maybe the stuff that's not the healthiest is awesome. That's a great opportunity to get together. And so, yes, it's everything in balance, everything in moderation, but helping them to understand like, hey, this is great. If we do this every day, we can run into problems.
Sure. Yeah. And I like how you talked about it being like this long-term thing, because I think a lot of times we'll be like, okay, well, this is just like they're in puberty. It's fine. Like they'll get it figured out. But I think we are setting the foundation for how we eat throughout our lives. But like, during this time of adolescence, we tend to choose things that like, oh, it's like too complicated to do that. I'll just do this. And so like, some families do it one way, other families do it other ways, and like teaching them how to like manage through that. Because when we think about college, like that like ramen noodle, like for every meal kind of deal, like I get it. It's cheap and whatever, but it's not nutritious. And like, yes, kids want it, but like, it's like, maybe let's just have that for lunch a couple days a week or one day a week and whatever. And then maybe when they get to college, they won't be eating it for like every meal every day.
Right, exactly. And I have a lot. I feel the ramen noodle diet like deep in my soul. I have a lot of parents who will say, hey, we have this conversation. He and I have this conversation regularly, but I want him to hear it from somebody, from his doctor. Like, how important is it to have a balanced diet? And not to like wander away from nutrition, but I have the same thing happen with like things like screen time. And I always come back to the habits that we're building now are going to stick with you. This is a very pivotal time in your development, in that what you get used to doing now is what your body's going to get used to doing long term. So if we can build healthy habits, if we can have that colorful plate with all the different, greens and whatever, now, then yes, the ramen noodles not super frequently in college is not going to be a huge issue. And we're also not going to have our bodies kind of used to the nutrient deficient diet rather than something that it can more optimally use.
Yes. Okay. So let's talk about, I think sometimes when I talk to teenage boys, they're all about like building their muscle, like wanting to get stronger, and they'll say like bulk up or, or slim down or whatever the thing is that particular person is doing. But it's all about growing muscle. Can you speak to like healthy ways to do that? Are there healthy ways to do that? And I know another thing that gets brought up a lot is creatine. So if we can make a note on that.
100%. Yeah, this is actually something that before I started here at Leawood Pediatrics, I didn't run into this question a whole lot, and I have run into it a lot, even just in the 1 year that I've been here. So 100%, especially in athletic boys, what we want to grow tall and build muscle, and I completely get that. There are good ways to go about doing that, and then there are some not as great ways to go about doing that. I generally say for any boy that is pre-pubertal doing, when it comes to fitness, it is okay to do body weight sort of things. So, push-ups, sit-ups, that sort of thing. Lifting weights before you start puberty can have some negative effects on growth even. And typically when I tell people that, then they're like, oh, okay, we don't want to do that. But it can cause your growth plates to ossify or start to close off prematurely.
And you definitely don't want that, because that would change how tall you are, right?
Exactly. That's gonna limit that growth spurt that we were talking about earlier. Because the growth plates, once they close, they don't reopen. And so, when I say growth plates, I mean the plates at the end of the bone, because that's where the bone is getting physically longer. So that's not what we want. Now, once we get into high school and we're in the throes of puberty, or maybe even starting to get out of puberty a little bit, that's also when things like basketball, things like football, those are getting to be pretty important components of our lives. And a lot of boys want to bulk up. You go to the weight room regularly. I am all for lifting weights safely. I think that's the biggest thing, is that for boys who are wanting to put on muscle and to gain muscle and gain weight, the biggest thing is to have somebody who knows what they're doing in the weight room that can teach you. It's not just about picking up heavy things and putting them back down. It's about doing it in a safe manner, because any injuries that you sustain kind of in the teenage years, they can last well into adulthood. And so, I am all for the weightlifting and everything, especially, I mean, you're going to have football coaches that are going to want you to do that. And I get it. It's part of the game. But making sure that it's done in a safe and controlled manner with people who know the form of different lifts is crucial. When it comes to supplemental, like dietary supplements for bulking up or gaining weight or building muscle, creatine is the one that comes up the most frequently. I reviewed the American Academy of Pediatrics guidelines before we taped this, just because I wanted to make sure that I was not speaking out of turn. But the short version of the creatine guidelines is we don't know the safety of creatine use in kids under the age of 18. Creatine has been shown to build muscle. It has. I mean, if you are working out and taking creatine, it will optimize your muscle gain. The problem is the side effects of it. Creatine is very harsh on the kidneys. And so it's something that when I have a boy who's taking creatine as a supplement regularly, it's something that we may even need to get regular blood work to make sure that your kidneys are still functioning at the level that they're supposed to, because the creatine can be so hard on the kidneys. The other thing is that if you're taking creatine, you have to be working out to a maximal degree to really take advantage of it. By that, I mean that the amount of weightlifting that you have to do to optimize what the benefit that you're going to get from creatine is a lot. And many boys simply aren't doing that. You're doing other stuff. You're going to school. You're hanging out with friends. You're not in the weight room all the time. So that's where we run into issues. It's because then you can put on weight that you don't want, things like fat tissue and things like that, whenever you're taking creatine. And so I'm always very cautious. Uh-oh. There we go. In my older kids who are getting like closer to 17 and 18, we have a conversation about it. In younger kids, 13, 14, that are asking about it, extreme caution and really discouraging them from taking creatine, because we just don't know the safety of it. The other thing is that it can be quite dehydrating. And so if you're taking creatine and then you're going to play in a football game, and it's, I mean, here in Kansas City today, I think the high is like 90 something with feels like 1,000,000% humidity. It can, if you're taking creatine and running around on a football field, you are at an extreme risk for muscle cramps. And so it's just, there's a lot that we don't know in terms of the balance and the safety of it when it comes to creatine specifically, that it's a conversation that you should have with your pediatrician or your doctor about the best way to go about it. To the point where it's always, I think it's always helpful to have like a licensed nutritionist kind of weigh in. And so that we can really make sure that we're doing this much like the weightlifting in a safe way.
Yeah. So, I mean, I think like if somebody's wanting to build muscle, just generally, like they're wanting to grow muscle, but we're not adding supplements. I mean, consuming protein helps to build your body, right? Like it's a good way to add calories in, but like lots of energy. But I mean, is that a way that younger boys can focus on? I mean, not too much protein. Obviously, it's everything in balance, but like making sure that it's like more chicken than Cheez-Its.
Exactly. That's wow. I'm going to totally steal that. Yes, 100%. It is going to be more chicken than Cheez-Its. It's going to be high protein diets, and not so much the junk food, again, because it's just you're not going to get the results that you want. My wife is actually, she's a physician assistant, but she is her passion is also fitness, and she's a personal trainer. And she always tells me you can't outrun a bad diet, meaning you can't get the results that you want from a diet that is lacking in what you need. And so the high protein diets with an adequate amount of carbohydrates to ensure that you're getting the calories that you need to kind of build that muscle, that's going to be the most helpful.
Yes. Well, and I think sometimes, I've had kids say to me like, well, I'm just eating chicken. And I'm like, no, you have to have other things too. Like your body doesn't just run off of that. Like it's the variety, right? And our brains also need carbohydrates, like to run, like our body runs on sugar. And so not literally sugar, but we're breaking everything down into sugar. And I mean, we can run our body on sugar. It doesn't go very well, right? There's lots of crashes. But I think, and so it's about that balance. And I think, we don't get a lot of this conversation, normally it comes out when boys want to build muscle and they're like, how do we do this? Right. Or their parents are like, you should eat vegetables. And they're like, whatever, like, I don't want to. And then, but it's that variety of foods that actually is helping to maximize each piece, whether it's muscle growth or your like growth as like how tall you are or your brain capacity, right? Like I think all of the things in our body are growing, and we want to provide it lots of nutritional options to pull from. Absolutely. Any vitamins that like you find that boys are talking about or should use or not use? Like, are daily vitamins okay? I mean, like, I know there's just so many supplements out there.
Absolutely. Yeah. I mean, you're never going to go wrong with a multivitamin. I mean, that's kind of, that can always be a daily multivitamin is always helpful in terms of helping your body to meet any vitamin deficiencies that you're not getting throughout the day, just in your everyday diet. You know, most vitamins are water soluble, meaning if you get more than what your body can use, it's just going to pass out of you. And so that a multivitamin is always helpful. The supplement world is a whole black hole in and of itself. And so that's where I lean on our nutrition colleagues significantly in terms of helping to identify which supplements are helpful. There aren't any off the top of my head that I'm going to like recommend or not recommend. It's going to be very much a conversation with your pediatrician and really getting into your diet, seeing what you have, what you lack. And then, like you said, to make sure that we're getting everything. Too much of anything is going to cause some problems. And so, but I mean, the multivitamin is a great place to start. And then beyond there, that's when I would, have a conversation with your pediatrician, get plugged in with a nutritionist and figure out what can be most helpful.
Yeah. Okay. Talk to me about sleep, because we know that teenagers love sleep.
Yes.
So what changes for boys during this process of puberty and sleep?
Yeah. So sleep is a huge thing, because I just think a lot of your day, your awake time is dependent upon your sleep time. And so sleep regulation is going to be the biggest thing. Sleep is where we grow the most. The studies have shown that your bones do grow at a more rapid rate when you are asleep. And so there's that. There's only so much you can control with that. You can't really outrun genetics or outsleep genetics. But I think that sleep regulation is the biggest thing, just because if your sleep is off, you're going to feel the effects during the daytime. And by that I mean not staying up. Your sleep needs throughout puberty are not dissimilar to your sleep needs before puberty. When you rewind the clock way back when you're a little like a toddler, you're going to bed at 7, 8 o'clock maybe. That's not like, I'm not saying that every 14-year-old boy needs to go to bed at 8 o'clock, but 2 a.m. is not going to be helpful with your circadian rhythm.
Yeah.
And so really what's most helpful is we're making sure that we're getting an ideal length of sleep, so at least 8 hours a night, and trying to ideally maximize the hours. But I always say the hours before midnight can be the most valuable. So trying to not stay up all night. I think that the biggest inhibitor, especially in the teenage years, especially in 2025, is screen time before bed. And I'm sure you see this a lot in your practice with, social media is pervasive in our society. And so I think that really the screen time before bed can throw off everything regarding sleep regulation. The blue light that our screens emanate from goes to our eyeballs, and it sends a signal to our brain to stop making melatonin. And that melatonin is what tells your brain it's time to rest. It's time to rest. So if you're constantly, and I know there's like blue light filters and blue light glasses and everything, but aside from the blue light itself, whatever you're doing on your phone is stimulating. If you're watching TikTok videos, yes, you're probably doing it passively, but it's still stimulating your brain to some extent. And so shutting the screens off at least an hour before bedtime, making sure that we're getting a good full night's sleep so that we're ready to go for school the next day or ready to go at practice the next morning is going to be the most helpful thing. It's vital from a hormonal regulation standpoint. It's vital from a growth standpoint. And it just puts you in a better mood, honestly. If you're sleeping, nobody's having a good time.
Yes. Yeah. I mean, we can all be grouchy, right? If we haven't eaten well enough, if we haven't slept, right? Like nobody needs any help with those areas, right? Of being grouchy. So it's like I think as a society, we are definitely sleep deficit. Like
100%.
as a country, we are not getting enough sleep. And that plays out in our lives. And then, the thing that I try to tell teens, but everybody, like, I'm not opposed to a nap, but research has shown that 25 minutes is the maximal time. Like, that is enough where you get like a renewal, like you feel like you can keep going, but you don't get into full sleep cycles. And so then you're not disrupting your nighttime sleep. But that's hard. People will be like 25 minutes. That's like nothing. And it is, because it's a go further, right? Like it is an effort to get through the rest of the day. And so if we're going to sleep at a regular time, then we probably won't need a nap. But if we do, and we get that little go further nap, then we're set, right? And then we can go further to get to the night where we go to bed at a reasonable hour. And then, we're able to grow our bodies and get to school and do our best in terms of like performance. And there's a lot of pressures. I definitely feel like there's a lot of pressure on kids to take so many advanced classes and things. And so there's a lot of studying. So it's not just a matter of like doing things that you're, are not benefiting you, maybe like being on your phone or whatever, but it's also like, starting your homework earlier helps. I mean, and I know that's super lame and, nobody wants to do that. They want to wait until the last minute, but it feels good when you are well slept. I'm like, yeah, I just feel so much better. Like a good night's sleep is like so restorative.
Absolutely. And I have seen this a little bit as well in my practice, where some kids are just, I mean, you're exactly right. There's a lot of pressures and there's a lot going on in their lives, and some kids are overextended. So when you're coming home from school and you've got practice until 5 p.m. and then after that, you've got your maybe practicing a musical instrument or whatever the case may be, if you're not even starting your homework for all of your AP classes that are very rigorous, then until 9 p.m., there's no way that you can possibly get enough sleep. And so that's where those are really hard conversations, both with kids and with parents, to say, hey, we may be overextended and we may need to scale back. All of these are great activities and I love that you're doing them, but it's just there's only 24 hours in the day and you are taking every inch of it, but it's just, there's not enough left at the end of the day. And so those are hard conversations to have, but sometimes necessary.
Yeah. Well, and we're also teaching our kids how to prioritize the things, right? Like what is the most important? We can't do everything. So which is the most important thing for you to do? And it is hard. I have that challenge in my practice too, but I don't think we have to do it all, right? Like, I did not go to an Ivy League school, and I feel like I'm living a pretty good professional life. And, like nobody asked me where I go to school. I always laugh because I'm like, nobody cares. Like once you did it, right? Like it's over. And they're like, you have the degree? Yep. I mean, nobody even asked me if I have the degree. The other day I was saying that to somebody and they're like, do you have the degree? I was like, I do. But it's like, nobody cares anymore. So I think we put a lot of focus, and I get that, but it's also thinking about imbalance, right? Back to this imbalance thing of like, we want our kids to be social and hang out with friends. If they miss every social outing that their friends are doing, they're going to feel lonely. They are going to be more susceptible to other mental health concerns. And so we don't want that. If there's something we can do to help prevent that, then it's also that balance part, right? Like, and it's not that I think every mental health thing is preventable. It's just that, the more we're keeping things in balance, the more that it seems easier to manage.
Absolutely. And I'm probably preaching to the choir here, but this is just the puberty and the teenage years are such a vital time when kids are connecting with peers, with friends. They're learning how to interact with people their own age. And so if we're not giving them that opportunity to do that independently and organically, it's tough. It makes things hard and stressful. That's where and again, I'm certain that you see this a lot in your practice. That's where things like anxiety can really kind of crop up, is just because we haven't enabled these kids well enough to explore their environment and explore their world on their own. Everything feels too too structured, too regimented, and just too much.
Yeah. Yeah, totally agree. Okay, so this next conversation, I think, is for parents equally as uncomfortable, not all parents, but for a lot of parents, to start this conversation about sex and about, consent and healthy relationships. What is your advice in terms of let's start with, how do we talk about sex with our kids?
That's great question. I think that for the parents who are, especially like maybe the parents like with their oldest children, they haven't done this before. The first thing that I would kind of remind them is, again, kind of what we talked about at the beginning, which is you want your child learning this from you. You don't want them learning it from somewhere else. So it's going to be okay. It's going to come from you. They're going to be comfortable asking you the questions and coming to you about this. When it comes to discussing sex, I think it's a very, that's where knowing your child best and knowing what they are mature enough to kind of digest is extremely difficult, but important. And so whether that comes to like all of the emotions associated with sex, all of the kind of inherent things like risk and consent and the logistics of sex, I think that it's very much something that I think you have to preface and prepare them for. Like, hey, we're gonna be talking about this. You may have even heard some of your friends already talking about this or whatever. We're gonna sit down and we're gonna talk about it. And it's just different for every family. But I think that the biggest thing is to not shy away from it, because again, ignoring and pretending like your child isn't learning about sex is just false. I mean, they are from somewhere. And so I think that probably the preliminary steps is a little bit more scientific. What sex is, what the point of sex is, and all of that. And then as they kind of progress through the teenage years, through junior high school and through or junior high and high school, that's when you get into the more nuanced conversations about what sex means, what the emotions tied to it, vitally important things like consent, and just kind of how to approach sex as something that, though that is not happening maybe to you right now, it is something that will likely you'll be doing in the future. And so kind of being aware and asking all those questions now so that it's not awkward or uncomfortable, or you seek out answers from maybe not the best source, is important. That's a hard question. I don't know that I'm like it. I'm giving the most straightforward answers just because it's tough.
Yeah, I think what I find is early conversations are best, right? Like I think when you have a conversation with kids about puberty and sex when they're not in middle school yet, I find that they are more open to it. They're more curious. They'll tell you what their questions are. So you get a really good, authentic conversation about this topic. And then as they age, then it's not weird because it already was talked about when it wasn't weird, right? Like teens, like everything feels like, oh, so awkward and embarrassing and whatever. And so if we can get it before it feels that way, I find that that's when we have the most valuable conversations in terms of authentic questions, right? They're listening to you. They're not turning off. They're curious. And there's lots of books out there. I'll put some in the show notes for parents to look at that I think do a really good job of keeping on the facts, right? Like this isn't about personal feeling about things, but these are just what they are. And I think something parents forget is if they think that they're protecting their kids by not talking about it, the average age that kids are exposed to pornography, are you ready for this? Age 10.
Oh my gosh. Yeah.
Okay. So if that is the case, then we need to, and it's mostly accidental. And so it's one of those things where it's like, we also need to know what that is. We need to talk about things like this. And it is uncomfortable, but it's like, this is a way that you're protecting your kids. Kids who know about sex are actually more thoughtful about engaging in sex. And so being educational about it and saying like, this is like asking them, like, how would you know if you're ready to have sex, right? As they're aging, right? Like, this is not the elementary school conversation, but like the middle school conversation, because there are middle schoolers having sex, right? So we need to be talking about that, because they might say, well, I don't know. And you could offer some ideas of like, this is, you know, what I've heard people say, or like, this might be something you're with somebody that makes you feel this certain way. And you also feel these things, you have this maturity or whatever, because the reality is that just telling our kids not to do it is not the answer. They're going to choose, right?
Yeah.
They're going to decide what they think is best for them. And so our job as parents, I believe, is to give them the information so that they can make good choices. And for some of those kids, you know, they do choose not to have sex until they're in college, or, you know, until they're getting married or whatever that is. But I would say that statistically, that's not what we're seeing. And so we have an obligation to teach our kids about that, because otherwise kids also, I find that they engage in more sexual activities if they don't know what they are. Like, somebody will say, do you want to do this? And they're like, well, I don't want to feel weird or embarrassed. I don't know what it is. And so instead of asking, I'll just say yes, but that's not really what they're saying. They just don't know. And so they'll agree. But if you do know what things are, then you're like, oh, yes, I do want to do that, or no, I don't. And so then they can actually consent to whatever it is that they're engaging.
Right. And you're exactly right. And to kind of go off of the consent conversation, I mean, that is where the honesty and kind of honesty early is most helpful, because teaching your child that it is okay to say no to something that you are not comfortable with is crucial. Because if they, like you said, if they don't know what it is, or if they don't know that they don't have to be doing whatever this other person is wanting to do, then they're going to probably revert to yes. And that's even though they are not able to, you know, really fully understand the implications of that. So that is a huge component of it, I think, is really enabling your child to understand, like you said, early on, kind of the bread and butter, the logistics of it, and then moving into, as their emotional maturity progresses through junior high school, asking them questions, asking them what their friends are talking about. Because also if parents think that their friends aren't talking about it, they're just fooling themselves. I mean, what are your friends talking about it? What are you hearing? What do you think about that? What are your thoughts? Do you think that that's right? Do you think that it's not right? Like, where you have to have a barometer of maybe where your kid is to even start the conversation. And so I think that, again, it comes back to open and honest conversations, and maybe even a little bit earlier than what parents are think that is necessary. But I mean, you read the statistics yourself. I mean, it's happening earlier than what I think any of us are comfortable with, but that's still the reality.
Yeah. So we have to prepare our kids for that. And I think one thing I'll say on consent, I have a great book about consent, and I'll put that in the show notes too. But the thing I love about the book that talks about consent is, one, consent is not just for sex. Consent is for everything. We're consenting to stuff all day long. Like, when I asked you to be on this podcast, I wasn't like, Ryan, please, Dr. Steele, please be on this. I said, do you want to be on my podcast? And you said, yes. And so, like, consent is always enthusiastic, right? It's enthusiastic yes. Because if we don't, if somebody is saying, maybe, or not today, I mean, that's a sign of no. And so I think teaching our kids how to read that allows them to be in relationships where they're able to be authentically themselves, and the other people are able to be authentically themselves, even minus sex, right? Like, it's about like, do you want to go see this scary movie? And they're like, no, I'm like, scary movies are just not my thing. That they can be honest about that, and that people can accept that is where they're at. And the last thing I said, healthy relationships. I feel like we don't talk enough about this. This is something that I think we assume that kids know, but like, we know they don't. Do you find that?
It's interesting, because I think if you were to ask the average teenager, what is a healthy relationship to you? What do you view as a healthy relationship? I think you'd get some pretty topical, feedback, because I don't think they know. I don't think that that's really, like, while yes, I mean, maybe hopefully if their parents have a great marriage and they're seeing a happy, healthy relationship, cool. They may know what that it is healthy, but what are the characteristics of a healthy relationship, and how can you in your early romantic relationships, how can you work to have a healthy relationship, and what does that look like? And maybe what are some signs that maybe you or somebody doesn't have a healthy relationship? I think that it's kind of like we talked earlier. You gotta ask, what are your thoughts on this? What do you think? Because I guarantee you, well, I can't guarantee you, but I bet that your son is not sitting in his room thinking through what are the logistics of a healthy relationship.
No.
And so once prompted, I think that allows them to kind of engage and really like devote some intentional thinking about it. And they may surprise you. They may know more than you think they do, but I do think that helping them to think about what that is, and kind of guiding what are the characteristics of a healthy relationship? What are the characteristics of maybe a not so healthy relationship? And what do we do about that? Whether it's in your life or in somebody that you love's life, how do we address that? And so, boy, that's a great point. And these are, again, it comes back down to creating this space to have those conversations in the first place, so that it doesn't feel out of left field. It doesn't feel like it's coming out of nowhere.
Yeah. Yes. Such important stuff. Okay. So the last thing I feel like I should ask every doctor is, how do you know when things like meet the threshold of medical attention, right? When we're talking about puberty, right? Like, when do we know that, when should we seek out our doctors?
I would say seek out your doctor anytime you feel like you may have a question that you don't have the answer to. Honestly, when it comes to puberty, there's just so much that maybe parents, even if you feel like you know the answer, like if your son is asking you a question and you don't know the answer to it, or if you do know the answer to it, but you don't know how to articulate, I tell people that's literally my job. My job is to know the science behind what's going on in your body and to recognize what is normal and what's not normal. So it is okay to ask. I've been impressed by some of the boys and some of their questions in my visits in the clinic of the kind of insight that they have about their own bodies, and is this normal? And 95% of the time I'm able to say, yeah, that's normal. It's weird. It feels weird, but it's normal. And so I mean, of course there are kind of red flag signs that are significant fluctuations in weight, significant fluctuations in mood. Those can be signs that maybe something is really not okay. But I don't want to just limit it to that, because you don't have to know everything as a parent, and you don't have to know everything as a teenager. You don't have to know everything. And so if you've got questions, especially about the logistics of puberty and what's going on with your body, and is this normal? Is this not normal? Come ask. That's what they pay me for. So that's what it's my job to know that. So I know that's more of a vague answer, but I do try to give families like a really open-ended, so that they feel much like creating a safe space between you and your child. I try to create a safe space to come and ask those questions, so that you don't feel like, oh, I should know this.
Yeah, because there's so many things that happen, especially if you're not a boy and raising a boy, you don't know. Right. And if you're not a girl and raising a girl, like there are things that like logistically you're like, I don't have these body parts. I don't know. And so I said something, I was like, you may like have a penis, like a husband, right? But you don't own it. It's not yours. So you don't know all the pieces to this puzzle. So, I mean, that's so normal. And I think, if you're like, well, do we need a visit for this? Call in and leave a message with the phone nurse, right? And say, hey, we had this thing. Is this like visit worthy? Is this something the doctor could answer? Whatever. And they'll give you the information. I think getting it from a viable source versus Dr. Google, it can be really very helpful. And also like relieving any anxiety that your kid may have, or you have, about your child's development, to make sure that they're on track.
Absolutely. Yeah. And I generally say that if something feels off, it might be. So if something feels wrong, let's dive into it. Like if you're worried, I'm worried. And that goes for the teenager or the adult. And so if it feels, you know your body best, or you know your son best. And so if it feels wrong, let's address it.
Yeah. Love that. Okay. Thank you, Dr. Steele. This has been such a good conversation about boy puberty. And how to navigate it.
Me. Thank you so much for having me. This is awesome. I really appreciate the title of the podcast, Accidental Expert. I have felt like an accidental expert a lot. And so this has been a great opportunity to kind of to get some different perspective and everything. So thank you for having me.
Thanks again, Dr. Steele, for showing up today and to help us understand teenage boys and puberty and what we should expect and when to be concerned and all the things that we learned today. I'm so appreciative for your time. With that, I will say thank you so much for your time today. If you like what we're doing, if you'll please share our show with one of your friends, one of our episodes, and if you would also subscribe to our show by clicking the subscribe button, that would be amazing. We would so appreciate it. It helps us to get great guests and continue to provide you great content. With that, I will say thank you again for your time. Please follow us on Facebook, Instagram, TikTok, and YouTube, and keep the emails coming with future topic suggestions for shows to accidentalexperts@gmail.com. Have a lovely day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.